Williams gets on, we'll have him amend the agenda so we can take the actionable items first.
Okay. Thank you.
Just a reminder, we are live. We are live on YouTube. Thank you. Just a reminder, we are live.
Okay. Trying to go through to see if we have a quorum.
You do. Lucy Hoover will not be able to join us tonight. Dr. Halverson, I believe, is signing on a little bit later. Before you got on, we did announce that Mr. McCreath has to leave by 7, so we're going to ask to move the agenda so that the finance is done first, so the actionable items are completed.
Excellent. So we'll call the meeting to order and need approval of the agenda.
So move.
Second.
Second.
Excellent. Any discussion? All in favor?
Aye.
Aye.
Any opposed?
Aye.
Need approval of minutes?
So moved.
Second.
Second.
All in favor?
Aye.
Any opposed?
Aye.
Excellent. Then we will go down to the Finance Committee.
All right. So let's see, page 17. Okay. Can everyone hear me?
Yes.
Yeah.
What page does that begin on?
17.
Thank you.
Okay, so we need the approval of the September 9th Board of Health Finance Committee meeting minutes.
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. That gets us to page 19, which is the resolution, the expenditures for month ending August 31st, 2020. Expenditures for the month were $707,442.99.
Move approval.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. On page 20, we have the statement of fund balance. The ending balance is $10,209,998.97. It had an increase of $637,438.99 for the month. Any questions, comments, or concerns about that?
That would be an increase for the year. Year to date, we're running a surplus of 637, 438.99. That's for the whole year.
Yep. Perfect. Okay. On page 21, we have the financial review for month ending August 31st, 2020. It's the 11th month of the county fiscal year 2020, and it's the second month of the state fiscal year 2020. Revenue year to date budgeted was $11,317,788.17. Actual was $8,802,153.04, with a variance of $2,515,635. Expenses year to date budgeted were $11,322,820.67, and the actual encumbered was $8,164,714.05, with a variance of $3,158,107. Any questions, comments, or concerns?
It's Sam Barker here from the Motley Fool.
Okay. On page 22, we have the balance sheet. It's marked preliminary. Do you have anything that you want to point out or anything we need to take note of?
Well, actually, this is the earliest the third Tuesday can come in a month on the 15th. So it's kind of a fluid situation. So I did the very best I could to, estimate our revenues and expenditures. So, at this point, that's a pretty good estimate. So that's why you'll see some of the numbers down below, which actually they vary from this printout, but that's because the county doesn't do all their posting right away. They go through the audit and the process. So, and they really aren't configured to do interim reports. So, but at this point, I'm estimating we're going to have a good solid surplus for the fiscal year, and I'll just leave it at that. So.
Okay. Anybody have any questions, comments, or concerns in regards to the balance sheet? Okay. Pages 23 through 32 are the bank reconciliations. Anybody have any questions, comments, or concerns about those?
No.
Okay. That gets us to page 36. Revenue and expenditure report. It goes through to page 40. There's a bunch of transactions we need to look at.
Yeah, and again, it's a matter of the county not posting, and actually they even they made some adjustments prior to that. Angie, you'll on page 40, actually, we got our whole fee credit finally. They've done a little bit of housekeeping at the county finance level. So so there were some variations in some of the expenditures. And then last month, we actually overestimated the supplies because we got a little double posting there. So so overall, you know, we're doing fairly well. So it's especially with the addition of the host fees.
Great. Does anybody have any questions? Okay. G is the public health emergency reserve minimum graph. It's on page 41. We are just about 9 million cash on hand, which is significantly up from where we were at last year at this time, and well above our emergency line that we like to keep it. Any questions? Okay. Do we have any receivables in here?
No, I'll have to bring that up to date and have that next month. So we'll have it for, you know, year end.
Okay. That gets us to number 3 on page 42. We have the major expenditure requests. We did approve these in committee, so we just need a motion to accept those.
So moved.
Second.
Okay, any questions? Any discussion? All in favor?
Aye.
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 Any opposed? Okay, major expenditure requests are all approved. Then we need to go to page 73, which is the proposed contracts and agreements. The committee, finance committee approved letters A through D at the committee meeting. We just need a motion to bring those forward.
So moved.
Second.
Is there a second? Okay,
Second.
any discussion, any questions?
Did you say A through D are the ones that were approved?
We.
Yes. We'll have to do E separately. Okay, all in favor?
Aye.
Aye.
Any opposed? Okay, then we need to look at the Crusader Community Health, the integration and coordination of the Ryan White services. There is no dollar amount attached to this. Anything need to be noted on this before we go and ask for a motion?
So move.
Second. Okay, any questions, comments, discussion?
And this is a continuation agreement.
So no big changes.
No big changes, but it's the annual renewal.
Okay. All in favor?
Aye.
Aye.
Any opposed? Okay. Proposed contracts and agreements are complete. And that looks like it's the conclusion of our finance section.
And just to give everyone a little bit of a heads up, because we just got them yesterday, we are going to have some influenza agreements. I don't know, for the site agreements we're going to starting them up our vaccines earlier this year. And so we just received those documents and we will be polling the board after this meeting because we want to get vaccines out before, during the month of September, as soon as they're received earlier than October. So we will be polling the board on the location. Cheryl, do you have your sites? Do you have your list of sites, or do you want us to? Christina can bring them up. Oh, you're not, we can't hear you.
Cheryl's.
You're mute still.
Okay, sorry about that. All right, so we've got a couple of food banks. So it's Cornucopia, Carpenter's Place, Pecatonica, Winnebago County Fairgrounds, Rock River Valley Food Pantry, Northern Illinois Food Bank, and Windmill, what that is. So these are all sites that we'll be doing the flu clinics.
So we would have to vote on that by like email or a poll because it's not on the agenda tonight.
Correct.
Okay.
I just wanted to give you a heads up that, those are coming through. We'll try and get all of them together as quickly as possible. They're a little bit different model this year. If you notice, they're going to be more drive-through type settings and facilities. And we're trying to coordinate with food pantries kind of as a precursor to our pre-COVID, COVID-19 vaccination. So we will get those out and we'll have you vote on them by mail, by electronic.
Excellent.
Thank you.
Well, then if there's nothing further in finance, that concludes the finance portion of your evening this meeting.
Thank you so much, Jamie. We can go back up to the presentations for the COVID-19 data update.
And first of all, I'd like to make an introduction. If you're seeing Rebecca Lyons, Rebecca is our new Director of Public Health Emergency Preparedness. So this is her first Board of Health meeting. And so she has joined us during a pandemic, has spent the last week and a half running to catch up to speed on some things, but she's leading some of the planning efforts regarding mass vaccination.
Welcome, Rebecca.
Thanks.
Welcome. What a time to join the Board of Health.
It'll be a
Okay, are we ready for a COVID update?
Yes, sir.
Thank you very much. I'm going to try and see if I can share this out properly. Let's see. Are you able to see the
Yes.
slide deck?
Yes.
Okay, so this begins at page 9 of your board packet. I'm just going to walk through this. We've been doing these as of the end of the month. So most of the data in here is as of August 31st, although there's a few places we have some more current information. Right now, as of today, our total case count is 4857. The death count is 152. We're just above 96% recovery rate. The real notable change is that our positivity rate, which is a 7-day rolling average, has increased to 7.2 right now. But as of August 31st, it was at 4.6. This is just sort of the number of tests that were being done that we're reporting on relative to the positivity rate. So as of the end of last month, over 65,000 tests had been performed on Winnebago residents. The R0, the infection rate, is something that we do continue to track on a regular basis. Last month we reported it was below 1 here in Winnebago County. Now it is running above 1, unfortunately. But these are current rates as of this week. So the spread, as we've seen in our case counts, the numbers are going up. The spread does continue. This next slide kind of combines a couple of the slides that we've had in prior reports. One is looking at the sort of the, where you can see the surge of the date by date of onset are COVID cases, where really April and May is when the real surge was, but the case count continues. And then the second chart on this page is kind of the cumulative run that shows the increase in cases as well as the deaths as they're going. And of course, if anyone has any questions, please feel free to jump right in. I'll talk a little bit about positivity rates. So again, that first chart on this slide, you've seen that one before. That is our cumulative positivity rate. So since beginning of doing testing for those 65,000 people, sort of what's the overall positivity rate for the county? And those vertical lines indicate when the community sites opened up and the number of tests increased significantly and the overall rate declined. The second chart here is that rolling positivity rate. This was as of August 31st. And you can see that sort of towards the tail end of it, we started to see an increase in what that positivity rate was. And it has continued to increase. We've been up in the sort of in the 6 to 7 range, and hopefully it will start to come back down again. But by the state's metrics, 8% is where you don't want to hit 8% as far as from a warning point of view and from potential changes in behavior or mitigation efforts. But we are seeing that increase. This slide, so the first slide on here really sort of shows the overall distribution of our cases and our deaths by age group. And the chart on the left looks like it's been looking really throughout the months of the pandemic. We have that high peak in the 20 to 29 year age group, and it goes down from there. But you see on the orange bars, which are the deaths are in the over age 70 is where the vast majority of the deaths are. The second chart, though, was something that we pulled together just to begin to look at, to see with schools beginning to open up, are we seeing any shift at all kind of in that age distribution? And so the blue bar on that really is the up until August 1st, what was the age distribution? And then from August 1st and through August 31st, what was the age distribution? And you start to see a little bit on the 0 to 9, but in that 10 to 19 group, you start to see a bigger separation there in the number of cases. Not enough yet to sort of skew the percentages, but it's certainly something that we're going to be watching and wanting to drill into. So it's one of the ways to try and start to chunk things into more of time series to see changes. This slide, again, we've shared this with you before. This really has not changed much at all. And the gist of it in terms of the mix in terms of race and ethnicity is still the highlight is that green box. The African-American and Hispanic Latino populations are basically seeing twice as many cases as a percentage of cases as they reflect in our community. That disparity has not really changed over time. Similarly, we've shared this before. This is the communities of concern that looks at the case rate per 100,000 people by zip code. Those same top 5 zip codes have been the same top 5 zip codes. We've done a variety of efforts to outreach in there, to do education, to do mobile testing and things like that. And I think the first time we ran this, the zip code had the highest zip code was 1.8 times the overall rate. So maybe we're getting, things are evening out just a little bit, but that has not changed much. This is probably the one real new slide for you today. With the Winnebago schools opening, we just sort of wanted to give a very brief overview. This is why I don't have much data to report yet relative to school age, but you can see sort of over the course of August and into September, as the different school districts opened up in their hybrid models, this is where we're starting to monitor what's going on with those schools. Dr. Martell and others have been working very closely with the schools. There's ongoing calls with school nurses, with the administrators. There's daily interaction with them. Todd Kisner's team developed a red cap survey for school nurses to be able to report daily absences. And so if a child is being kept out of school and they get a call from a parent or they're sending somebody home, this is a way to capture that information. That information comes into us electronically, so we don't have emails or spreadsheets flying back and forth. So this tool that just and really went into effect this week is being used, and it allows us to identify those students who are out of school, what their contact information is, and what symptoms they were experiencing. And so we're hopeful that we'll be able to use this information to be able to report back as these come in.
And we're using this tool not only for students, but teachers and staff, which obviously in the 20 to 29 group and some of our workforce is really what's driving some of our numbers, even in the schools right now.
We did do one little slice to try to look at that increase again at the school age children, trying to look at the number of new cases we were seeing by week in those ages. The state is also tracking number of cases in the under 20, 0 to 19 group. We sort of broke them out, and it's too soon to see anything, but with the schools opening up in August, those last couple of weeks of August, we did see definite increases in the number of children that were identified as being COVID positive. And so as we get more information, more data, we may look to slice this going forward. And then again, just as a reminder, there's two major trackers out on the IDPH website that look at the county level risk metrics and are updated every week. And right now, Winnebago remains blue. We are getting warnings for the number of new cases per 100,000 residents, but we're okay on all the other indicators. And then we are also, the state is also tracking at the regional level, and our region right now, region 1, is okay. There are 2 regions that are 4 and 7. Because of their positivity rates going over 8% across the regions, they are under mitigation efforts from the state, or directions from the state. And that's all we have for you this evening. If there's any questions.
I have a question. Do you do the death rates by race and ethnicity?
We did look at that. I think we may have had that in one of the earlier monthly reports. We can certainly pull that together. For us right now, because the deaths are so heavily skewed towards the elderly population, a lot of folks who have been in nursing homes, actually, because 2/3 of our deaths are in congregate care settings, and that population is a largely Caucasian population. Right, I'm not sure that we are seeing some of the national data that's being reported as far as disparities in death rates. I'm not sure that we have that, but we can certainly take a deeper look at that and report on that.
There's also an embargoed report coming out tomorrow from the MMWR on children, and it seems to be impacting minority children.
Just one more question. I've noticed now the weather is going to start getting cooler, and restaurants have these tents. And if they put all the flaps down and encase the tent, aren't we just dealing with another restaurant, an indoor restaurant?
Ron, they've actually come out with an opinion on that. If two sides of the tent are up, it is considered outdoor dining. If three or more are down, it's considered indoor dining.
Okay. I've seen some outside indoor dining.
I know, and there are some articles. CDC is releasing some additional, it's a little small yet, on the association with restaurant and dining in correlation. I don't, when we initially saw some of these outbreaks and we saw some of our large case counts, they were coming out of our long-term congregate care facilities, some of the factories, we are now starting to see them in family groupings related to get-togethers where they have, larger than we would expect weddings, funerals, and now beginning to see some of that kind of concern with, there were some celebrations over Labor Day about returning to school that may have fed some of this latest outbreak. Northern DeKalb is going, which turned orange for a number of positive cases related to Northern Illinois University. We're not seeing one institution in particular, it's across the board. And it's very concerning because I think I know people like the pandemic to be over, but it's not over yet.
So that increase to 7.2% is not related to the Harlem and Rockford and Winnebago public schools and the private schools that we know of.
No, at this point, let me be clear. When we're talking about the numbers in the schools, now this can change. We have seen isolated cases in the schools. They're not being transmitted in the schools. So we're quarantining at a pretty high rate in those areas with the schools. And Todd will give a little more, can talk a little bit more with the contact tracing. But for instance, we had to quarantine based on a single contact and the number of children that were impacted. So those children are quarantined and we're not seeing them turn to positive cases at this time. So we're not seeing in a classroom where 2 or 3 students or a teacher and 2 or 3 students are contracted COVID and that's their linkage. We're seeing most of these infections have been acquired out in the community and the children are in the setting or the staff or teachers are in the setting.
Okay, that was okay.
How are we doing on returns and results on testing? How fast is it coming back?
That's the more in-depth. I know, Peter, we do the turnaround where we calculate the turnaround time. As of late, we have a new lab that's doing the University of Illinois College of Health Sciences campus and the community-based testing sites. Crusaders continue to use IDPH, and we've seen some very short turnaround times. And anecdotally, we're seeing 48 to 72 hours in those locations. But I know, Peter, probably with an analysis like we've done in the past, we'll be coming on a more complete study.
Yeah, and the turnaround time over the course of August, did not significantly change from what it had been in July. So, but as we are, I think with this new lab coming on, some of those turnaround times are starting to are shortening up. So we'll do a deeper dive back into that again.
Excellent. I think we can get some more answers when we talk to Todd about contact tracing update.
All righty. Well, hello, everybody. Since the last time we talked, our contact tracers, case investigators are in full swing. They have jumped in with both feet and have been doing an excellent job. We are working 7 days a week. They are. So as cases drop through Salesforce, every morning we've got folks jumping on and taking care of those cases. And with great success. They are using an app called Tulio built in within Salesforce, which some of the other areas in the States had some challenges because of the phone number isn't within the area code. So when folks call our cases, it comes up as a 312 number. And that's just beyond our control, but part of that. But we've had great success in using that application to interview folks. And the reason we're doing that is then it will log that call with that case right into their, lack of a better word, case file in Salesforce. So we don't have to do any manual entry after the phone call to go in to document that. It all automatically documents that right into Salesforce for us, which is fantastic. So anytime we talk to a confirmed case or a close contact through Tulio, it documents it right into the system for us. We haven't had too much problem with Salesforce, a couple glitches every once in a while, but for the most part, it is running really well as part of our case investigation and tracking contacts. And as we start to get into schools and siblings and stuff, we can identify contacts and connections a lot easier than in the old days, as I would call it, which wasn't too long ago, through an Excel spreadsheet and stuff. So Salesforce really has some great capabilities for us in our investigation and trying to determine if there's an outbreak in a setting and stuff based upon contact names or identified schools, businesses, whatever that may be. So they are in full swing with that. And then in addition, with the schools opening, they have been engaged in that. That is a lot of work, as Dr. Martell previously indicated. We've been, for any child that is either called off or sent home with symptoms of COVID, they either have to have a COVID-19 test or be seen by their pediatrician to be reviewed if it is COVID, or if it's not. If it's not, they have to provide us with an alternative diagnosis for that student to return to class. Or if a parent doesn't want either of those options, then that student is out for 10 days as isolation because they were symptomatic. Peter talked about our red cap, which we're really excited about. That has really helped us kind of settle the waves as they come in. The nurse in each of the schools are able to access that link, type in basic information about the student, demographics, parents, contact information, or in the case of a staff member, that same information. But then we ask them when they were sent home from school, when their last day in school was, and we list all the symptoms of COVID. So all they got to do is click on which ones they sent the student home with, or if the student's parents called in, mark what symptoms they had. So that kind of gives us a heads up first time as to what we've got going on. And so then the case investigators reaches out to mom and dad, mom or dad or a guardian, to touch base with them about their child being home for the next 10 days and advise them of the two options, kind of to return back to school before that 10 days, either a COVID test or alternative diagnosis from their pediatrician. And after that conversation, then it's logged into RedCap, and then a message is sent to the school nurse that reported it that says, hey, the health department has contacted and will be up to date to you when they come ready to go back to school. So then we work with mom and dad, depending on what it may be. Some are getting COVID tests and they're coming back negative, which is great. So then the parents or guardian, all they have to do is provide that negative lab results to the nurse. And then the student is allowed back into the classroom. For our UIC testing facility, community site, and the Crusader, if the students happen to get tested there, the health department is providing a letter for the parent to say that their student was tested and the results were negative. Because with UIC's testing, it's very difficult to get an actual physical lab report from them. And with Crusader, we don't want to bombard them with trying everybody to try to get a lab result when we can see those and simply send off a letter to mom and dad, and then they can forward it on to the nurse. So all of that has been working really great in RedCap, and I think the nurses appreciate that, the ease of doing that, so they don't have to fill out any fancy spreadsheet or email us all the time, and then notifying them. That helps them to know we've got it and we're working on it. So as the students either test negative or have an alternative diagnosis, we're assisting getting them back to school. In that with the nurses, letting them know it's okay for them to come back. In the event we have a positive student with COVID or close contacts that are quarantined, this same idea in the sense of with our case investigators is we're working with them, and we'll provide a letter for the student to return back to class, either after their isolation period is over or their quarantine. So on day 14 of the isolation, or day 14 for quarantine, or day 10 for isolation, the case investigators are contacting the parents to say, is Todd feeling better? Has he been fever-free if he's under isolation? And if they agree yes, then we send them a letter to say, Todd is off isolation as of today. They can return to school the next school day, depending on when their last day falls. We are coming up to some of that with our cases as we've experienced in school. So a lot of work with the schools. Thank you to Dr. Martell for running with the nurses and keeping them ahead with us. And they've been wonderful with it. And the team has been extraordinary. The new team members, and I say us old ones on the team, have been phenomenal working with these schools, because it always seems about Friday, about 4 o'clock is when we get noticed. So, they've all jumped on last weekend and noticing the families that we had to with Parker School. That was a huge endeavor, but the team jumped in and got right on the phone Saturday morning. And by 1 o'clock, we had all the families contacted and advised what steps they had to take. So been a busy couple of weeks, but we keep moving right along.
And I think Todd brings up a good point. So Dr. Williams, I need your help over in the medical community group. This is a change for the medical practice. I mean, most of the time by HIPAA, we're not sharing what people's diagnoses are on this because we are part of a pandemic. We do need the alternative diagnosis. So if the child has asthma, if they have seasonal allergies, if they have a stomach ache, if they have any of those things that they are ruling out COVID, then we need that diagnosis before we can let that child back into the classroom setting. It's not sufficient just to say Sandy can return in 48 hours. Because here is where they're really, I'm calling them the guardians of the castle. They are, you can't cross that moat. You can't get into those schools without that. And I know that I've had to send some notes back to physicians and say, not sufficient. And they've worked with us as well. But so that's been a huge, and then Cynthia Hall and the Joint Information Center has been the one that's been helping the schools draft communication. And you can tell there's a lot of media interest about this because, how many children are sick, how many, who's getting exposed. I mean, and so we have to be cautious about how this is messaged so that the privacy and confidentiality of the individuals. But for every one of these schools, there has been a Joint Information Center group that has worked to communicate. Certainly, Cynthia, you can add to.
You lost your microphone.
There it goes.
Yeah, and again, it really is a huge team effort to keep these schools, I'm going to say, in session for some in-person learning, protecting the individual's privacy and confidentiality, whether it's a small child or a teacher or someone who works in the school. It is a full-time effort to keep this moving. And as we look at these positivity rates, I've had to have some harsh conversations about you choose. Do you want bars or do you want schools? Where do you want to go on this? But I want to also say there's been kind of a positive before Todd gets into the enforcement. He can talk more about the bar side of it. But a couple of groups were vaccinating. I don't know, teachers were in the schools and saw the little ones. Think about all the new kids coming into school, kindergartners. They know no difference. They put their masks on, they come in, they're so excited to be at school. And, you know, we forget about how much they really have wanted to be in those in-person environments. And I think the work that the schools are doing, similar to what our food establishments did to make it as safe as possible, recognizing that this was an important endeavor, but they do keep us busy.
So let me make sure I understand before I send out a message. If a child misses school because they're ill, and the doctor has to send a note saying the child can go back to school, it's not enough to say that the child didn't have COVID. They want an actual diagnosis of why they missed school.
Yes. They want an alternate diagnosis in the absence of a negative COVID test.
In the absence of a negative COVID test. So,
Right.
But if the child had a negative COVID test, then the alternative diagnosis is not needed.
Correct.
Got it. All right.
And I'll be happy to send the IDPH. I know it went out I sent it out through the health systems, and I think American Academy is putting that out as well, but it may not catch all the family practice providers and all of that. We get that.
I'll just send it to me, and I'll make sure, at least for
Dr. Williams.
one medical group, they'll get it.
And I know, Pat, you can go back to the U of I and those school nurses, that they're the guardians of the gate, as we call them.
Okay. So are we ready for Todd Marshall and the enforcement update?
Well, good evening, everybody. Environmental health continues to take complaints to the COVID hotline, the COVID email. We do log them, track them. We do go out there to observe, investigate, document what we observed out there on internal sheets. Is basically a checklist of the factors that may cause the transmission. Obviously, it's the mask wearing, social distancing, those kind of things. What we're seeing a lot is with the education piece, hopefully that's all we need to do, but we are stepping into that next tier of enforcement. But the education piece is continue to clarify the rules, the guidances, doing walkthroughs if needed, but really stressing the importance of the things that we're really looking for. And it's truly getting the signage out there, making sure on your social media platforms that you're saying that you must wear a mask to get the buy-in from the customers, and also have those masks available, so there isn't that confrontation and all of that. But as you heard at the press conference, yes, we are getting that next year. We've been tracking this since we went into phase 4, June 26, actually prior to that, but from June 26, I think we're around 600 to 700 complaints. And once you get up to that 3 of non-compliance, we do issue out a notice of non-compliance. It's basically a form that came from the state indicating what the violation was, what we observed, what dates that we observed, and the time to correct it, which is in that 14 days. And once you do that 14 days, and we're in that with 2 facilities and a school. And once we go back, hopefully I have talked to all 3 of them about corrective actions. But once you do get a notice of non-compliance, you are put on our website as transparency. And that has been discussions with our work groups. And I'm starting to hopefully see some more better compliance. They're starting to realize what I keep on telling them is we don't want to revert back. And obviously, as Peter was saying, that we're on a general incline here with our positivity rate. So again, Dr. Martell was talking about bars. We're seeing a lot of those social media platforms that people are taking pictures on Facebook, sending us these live bands, which are acceptable, but they're supposed to only have 25% standing room only. Well, they're in violation of that. We can just tell by the pictures that are being taken. With the support of administration in finance and all that, we are asking my staff to go out there on the Friday and Saturday nights. There's definitely a few establishments after several times of conversation and education. It's just not getting through. So in order for us to get them, how can I say, through the enforcement procedures, we have to observe it. And obviously in the daytime, we just don't. So that's why we're going at nighttime. And they'll start this Friday. We did a little bit last Saturday night. And yes, there was violations of not social distancing, capacity, all those. Not only that, but we are working also with guidelines. We continue to develop guidelines as the year goes through. We're in the apple orchards and pumpkin patches. So we're on that. We developed those. Now we're going to get into the Halloween activities. Haunted houses, trick or treat, trunk and treat. So we're doing all those things. But also, again, working with these work groups, trying to have them understand those enforcement procedures that we have email blasted out, clarifying those, and hopefully we don't have to go any farther. And again, that press conference, the word is out, and been awfully busy with that. So I think that's, any questions on enforcement at all at this time?
Has there been any negative feedback from, was it last night that Berean Baptist and other institutions were actually named in a press conference?
Actually, the school and the two facilities, of course, called, and they were frustrated about that. Of course, my job as the director is explain the reasoning why, and they've had multiple chances, education, corrective actions at that time, and they just didn't listen. And they knew this was coming. And now once I guess the tire hits the road, now they're frustrated. And there's a lot of venting. I'm the I guess the middle person. I guess I'd call the frontline person. And a lot of venting, but then they understand. They want to, it's not us against them. It's as them as a community to hopefully to keep those numbers down so we can move forward and hopefully
they can always go through with the corrective actions. I mean,
right. And Todd and I have, again, it's part of the procedures that we put together, and we had business support who is also coming with us and saying, when are you going to start enforcing at a higher? And remember, the governors went through that order, the executive order. We have an MOU right now with the city of Rockford on enforcement activities, and we have several other communities that are also looking at this. I think there's a recognition that one or two outliers are creating some really significant, no business wants to see us to have to go to what the other regions may have, which may be a reduction in capacity or totally, shut down any indoor, dining or that, or close down bars completely. And so they really have to get in alignment on this. So we released the procedures. We told them how this was going to operate. The public has also been wanting to know what's going on. And so it really, in the issue of transparency, we're putting it out there. And hopefully they'll apply some positive peer pressure to each other to get into compliance. I'm going to say that by the time you're on this list, you have chosen not to comply. By the time you're on that, you've had 3 validated complaints. And this is not just, I'm going to say, one individual calling incessantly on one business. These are multiple sources on complaints. And it has been multiple attempts to go in. We are not doing, oftentimes we'll hear about a complaint and Todd will say, we go in if there are policies and procedures, if there's signage up, if they have masks, if the majority of individuals, when you walk in there, are all compliant, we know that there's an intent to comply. What we're seeing in these very extreme cases is, there's no intent. In fact, the school, if you were to go on their website, their school policy indicated that masks were not required.
True. It's the public health principles. Obviously, we want that intent and a high percentage, obviously, we're looking for those outliers, those ones that actually put negative signage up, and not trying to comply in any way. And we do have them, and the facilities in the school, yes, they were given plenty of chances, and we did talk to them. So
Excellent. Thank you. All right. Looking at the agenda, there's no policy, personnel, or quality meetings. Of new business, of note, it was, with sadness, I believe this is Jamie's last meeting. She's moving on to bigger and better things. And I want to thank her for all her service to the Board of Health, especially with finance, because that's not easy. And she was dedicated and she was outstanding in her job. And I appreciate everything you did, and wish you all the best in every and all future endeavors.
Thank you.
I wish we could be together so we could.
I will miss you all.
Group hug.
I know, but I wanted to finish out the year, and but thank you. Yes, I'm going to miss you. I'm moving next week to Wisconsin, so it's not like I'm just going to be in the area. I'm actually moving a little bit of a distance and going to start a new adventure.
We wish you well.
You sure do.
You sure do.
Absolutely.
I have enjoyed all of my time.
Every finance committee meeting?
Not everyone, but 90% of them.
Now I know as the administrator and as someone who's worked with you, you will definitely be missed, and we appreciate all the confirmations you made in really helping us on some of our food establishment concerns and issues as we move through this, and certainly leading us through many of our finance committees with Dr. Halverson. So you will be missed, and of course, Wisconsin's very close. Remember that.
Right, exactly.
Excellent. On that not so happy note, we need a motion to adjourn.
So moved.
Second. All in favor?
Aye.
Aye.
Again, Jamie, congratulations, and I know you're going to crush whatever you do.
Thank you. I appreciate it.
Bye, Jamie.
That's good.
Bye.
Bye.
Good night.